Anti-NMDA encephalitis is also known as autoimmune encephalitis. Sometimes it's referred to as the disease of madness.
Susanna is in her early 20s with a new job and bright future ahead of her. Susanna has suddenly not been feeling herself lately, and the first thing that we must all know is why Susanna is acting and feeling so different than her usual self. To find out what is going on with her, we first must look at how and why she's been experiencing these things, such as a cough, or feeling dizzy, or everything spinning around and blurry, or one moment she is happy and the next moment she's angry, just like a switch of a button. All these actions you see are what we call symptoms, and Susanna is experiencing many symptoms. Symptoms is what helps doctors to determine why Susanna is acting and feeling like this, and what other similar symptoms also occur with another illness, which is called a condition. Just like feeling sick, it then can be found out what is wrong with Susanna, so we can treat and help her, which is called diagnosing. This diagnosis is similar to a guess, however, using medical and other important information to figure out the best guess so we can have it being the most accurately possible guess. In other words, a hypothesized diagnosis. So let's take a look. She begins with coughing and starts getting migraines or headaches. She then starts hearing voices that aren't actually there, called hallucinations, and seeing things that aren't actually there, like red dots on her arms.
I don't know what I'm looking at. No, I don't see. Fine.
She hallucinates more by hearing water drip down of the tap, but nothing is actually dripping.
Dude, I gotta change. I gotta do it.
Here we can see Susanna very happy, but all of a sudden, just like that, her mood changes, and she's sad and frustrated.
No, God, no,
It then leads to a seizure, a very severe seizure. After looking at all of Susanna's symptoms, we can use that information to try and decide what is wrong and make the best decision possible using that information to figure out what her sickness is, that being a diagnosis. Although we do not know exactly what is wrong with her, we can essentially guess with a good feeling of being correct, that being called an hypothesis diagnosis, or hypothesizing a diagnosis. Susanna has been experiencing many stages of a certain sickness called anti-NMDA receptor encephalitis, which is a condition where it is like your brain is on fire and is slowly over time dying if no treatment is used to help. We can tell this as many other people that have had the same condition show similar symptoms, just like Susanna. And because Susanna is expressing many symptoms of encephalitis, just like others, we can use that information and have a good prediction that Susanna does have anti-NMDA receptor encephalitis.
There are three key structures that are involved in anti-NMDA receptor encephalitis. These areas are the dorsolateral prefrontal cortex, the ventral tegmental area, and the hippocampus. The dorsolateral prefrontal cortex is located in the frontal lobe of the brain. The frontal lobe is divided into 5 regions, with the prefrontal cortex at the very front of the brain. This area is divided into another 3 areas: the ventral medial prefrontal cortex, the orbital frontal prefrontal cortex, and the dorsolateral prefrontal cortex. The dorsolateral prefrontal cortex is involved in sensory input, short-term memory, and motor signaling. This region does not directly affect emotion, but does play a role in influencing mood. The prefrontal cortex also plays a major role in cognition, including maintenance, manipulation, and the utilization of mental representations. The next region involved is called the ventral tegmental area. The VTA is located in the midbrain and sits across from the substantia nigra and above the pons and hindbrain. It plays a large role in how we feel motivated and rewarded, as well as how we think and why we don't like certain things. The VTA is often linked to psychiatric disorders such as schizophrenia, which is a large symptom of encephalitis. The VTA is also filled with lots and lots of dopamine neurons. Dopamine neurons are neurotransmitters that release dopamine. A neurotransmitter is a chemical key that allows neurons to communicate with each other. An excessive amount of the dopamine neurotransmitter can cause schizophrenia and can have a significant effect on mood. Dopamine, like the VTA, also has a role in reward, motivation, and cognition. Another neurotransmitter involved in encephalitis is called glutamate. Glutamate is linked to a few different psychiatric disorders, including schizophrenia. Glutamate is also involved in seizures, movement, and autonomic instability, which means that the automatic functions in your body, such as breathing, are not working correctly. The last key region involved is the hippocampus, which is located deep in the temporal lobe of the cerebral cortex. The hippocampus plays a major role in learning and memory. It's made of grey matter tissue and is curved like the body of a seahorse, which is where it gets its name, as hippocampus means seahorse in Greek. The hippocampus can have an effect on emotional behavior as well as motor behavior, which is the ability to move your body. The hippocampus has also been found to be important in spatial navigation, memory, and learning. This structure is also involved in schizophrenia and seizures.
Anti-NMDA encephalitis is related to nerve cell damage to the antibodies, which are proteins used by the immune system to recognize and fight disease. When someone has anti-NMDA encephalitis, their antibodies attack their own body, also known as an autoimmune response. In this case, they are attacking specifically the NMDA glutamate receptors, which are found all throughout the central nervous system. Researchers remain unsure why or how this is caused. Researchers currently propose 3 theories to explain anti-NMDA encephalitis. The first theory is that antibodies bind together and cause the receptor to move inside itself, decreasing the amount of receptors available to connect to. The second theory is that antibodies may act as a physical barrier to block positive or negative ion entry. And the third theory is that the interaction between the foreign substance or disease, also known as an antigen, and the antibody may cause proteins to clump together and cause water cells to burst. However, this seems unlikely, as the cells affected by anti-NMDA encephalitis seem to be at least partially functional. A similar disease caused by an infection in the brain by the herpes simplex virus may trigger anti-NMDAR encephalitis. This disease is called the herpes simplex virus 1 encephalitis, also known as HSVE. A case report showed that a previously healthy 24-year-old man was examined and found to have HSVE. He recovered after a few weeks, however was later readmitted with similar symptoms, and doctors believed he had relapsed into HSVE again. However, doctors found NMDAR antibodies that had not been present when he was first examined in his cerebrospinal fluid, suggesting an infectious trigger of anti-NMDA encephalitis. The connective tissue that binds and connects the nervous system, also known as neuroglial tissue, within a type of tumor called a teratoma, may also be involved in anti-NMDA encephalitis. This may be especially true for teratomas found in the ovaries, which are female reproductive organs. Additionally, anti-NMDAR encephalitis could also be explained by damage to bundles of insulated parts of nerve cells, called white matter, in patients with incomplete recovery. For Susanna, it is unclear what triggered her encephalitis.
In a healthy brain, NMDA receptors are located on a neuron, usually in the thalamus or frontal cortex, that will release gamma-aminobutyric acid, also known as GABA, when the neuron is fired. The GABA then goes on to inhibit postsynaptic glutamatergic neurons. This regulates glutamate and dopamine in the frontal cortex in a healthy brain. Antibodies can originate from the bloodstream within the blood serum component or the CSF. Blood sample can only rule out blood serum originating anti-NMDA encephalitis, so often a lumbar puncture is required. Sometimes the anti-NMDA receptor autoantibodies can be associated with a tumor, usually a teratoma, usually ovarian. Teratomas can trigger the production of IgG antibodies. When teratomas are present, anti-NMDA receptor encephalitis is then referred to as a paraneoplastic disease, meaning it is associated with a new growth in the body. Teratomas are a type of cancerous growth that can contain all sorts of body tissues, from teeth to hair to muscle. Anti-NMDA encephalitis occurs when the body creates IgG antibodies that act on the NR1 or NR2 subunits of the NMDA receptor. This leads to hypofunction of the NMDA receptors for these GABAergic neurons. Therefore, when GABA is not sufficiently produced to inhibit the glutamatergic postsynaptic neuron, it causes hyperproduction of glutamate and dopamine. When the IgG antibodies bind, they initiate the immune system to attack the NMDA receptors, causing inflammation in the brain. Patients with schizophrenia are thought to have brains where neurons either produce too much dopamine or they have too many D2 receptors, causing poor regulation of dopamine pathways in the frontal cortex. This affects arousal, motor functions, motivation, and more. This is thought to be why anti-NMDA receptor encephalitis mimics symptoms of schizophrenia. It is also the reason for Susanna's catatonia. Treatments are mainly focused on decreasing inflammation of the brain, so IV steroids are administered to help suppress the immune system. IV immunoglobulin from healthy donors can be used to introduce healthy plasma. Some monoclonal antibodies can be used too, including rituximab, which reduces cell effects in B cells, which are part of the immune response.
The implications are the results or what is to be expected after an illness. This involves recovery and treatment, life after treatment, and if other illnesses can occur. Treatment of this disease can be very challenging and slow for the patient, taking months or years to recover. Treatment usually involves removal of a tumour if present in the patient, and a mix of medications such as steroids, intravenous immunoglobulin, let's just call that IVIG, and lastly plasma exchange. You may know IVIG as a drip, a type of infusion. These treatments help to normalize cell levels of the immune system and protein in the blood. So I guess sometimes eating your vegetables isn't enough. Plasma exchange is a thorough process of separating plasma from the blood and replacing this with a cleaner plasma fluid given by nurses or doctors. These treatments are the common first-line care for this autoimmune illness, meaning other treatments are available and may be necessary. This is because first-line treatment is not as effective for some patients, and doctors are still learning about autoimmune encephalitis. First-line treatment typically sees more reoccurrence of encephalitis. It is reported that 14 to 25% of patients encounter this illness again, while in second-line treatment, this is less likely. We'll give that a thumbs up. Specialized doctors are usually needed for this illness. A specialized doctor is one that focuses on something unique. Encephalitis is unique to every person. On average, it can take 14 months to recover. This can be hard on the patient and the patient's family and friends. Not all patients get better. Some need to learn to walk again. Some take months to hear people speak again. Personality changes can also occur and be long-term. The person you knew before who loved dogs or sings beautifully maybe now hates dogs and sings terribly, even once they have fully recovered. Not everyone is as lucky as Susanna. Permanent brain damage or death can result if this illness is left untreated. Brain damage can involve memory, speech, or language issues, and physical problems such as motor movement. These conditions may last a lifetime. Speaking of brain damage, acquired brain injury is something that can occur after this illness. Encephalitis is an extreme inflammation of the brain. Susanna was treated early and was able to function normally again. People who suffer from severe nerve damage in the brain will result in an ABI. Brain damage can involve memory, speech, or language issues and physical problems such as motor movement. These may last a lifetime and differs from patient to patient. Additionally, teratomas and epilepsy are illnesses that occur after encephalitis. Teratomas are small to large lumps in the body, a tumour, often known as ovarian teratomas in women and testicular teratomas in men. Many encephalitis cases involve the diagnosis of a teratoma. Screening for finding teratomas becomes a long-term process. The consequences of the teratoma involves the removal of this lump by surgery, which may result in men or women becoming infertile, meaning they can no longer have children. Susanna was a case harder to diagnose. This is because she had no teratoma, and this illness was widely unheard of until she shared her story. As for epilepsy, symptoms of anti-NMDA encephalitis included seizures. These often become lifelong after recovery, and sometimes become present many, many years later. Typically, after the recovery of encephalitis, patients will need to take medications for epilepsy or be aware they are now at high risk of developing epilepsy in the future. So as you can see, autoimmune encephalitis is a pretty nasty illness, the disease of madness. Susanna was one lucky patient who still suffered greatly. She is now one giant reason autoimmune encephalitis is spoken about and more recognized and understood. Thanks.